I now recognize Ms. Tokuda from Hawaii for 5 minutes of questions.
Thank you very much, Mr. Chair. You know, living in a nursing home during the pandemic became a death sentence for approximately 176,000 Americans. And today, nursing home staff continue to have one of the most dangerous jobs in our country. According to the CDC, there are 15,600 Medicare and Medicaid certified nursing homes and 1.7 million beds providing care to our constituents in every district across our country. Dr. Grabowski, we know nursing home residents and workers were a vulnerable population during the COVID-19 pandemic. Now, 3 years later, would you say they are more or less vulnerable if faced with evolving or new, rapidly spreading viruses?
You know, I think we're in much better shape relative to COVID, but moving forward, as new pandemics occur, we need to apply the lessons that we've all been talking about here and apply good policy going forward. I do think we have staffing shortages in some of our buildings, and that's going to be an issue going forward. We really need to fortify the workforce.
Thank you. And building on that, you know, and definitely staffing shortages is a severe crisis right now our public health infrastructure is facing. If there is one critical lesson we've learned from COVID-19, it is the importance of sustained and adequate investments in programs that ensure the health and safety of our nation's nursing home and long-term care residents, from resources for adequate staffing, as we just talked about, to oversight and monitoring. Yet as we're having this hearing, House Republicans continue to hold America's full faith and credit hostage so that they can push draconian cuts to crucial federal programs meant to protect nursing home residents from harm. For example, Republicans' Default on America Act contains a 22% cut to the Centers for Medicare and Medicaid Services State Survey and Certification Program. CMS's survey and certification efforts help the agency determine whether nursing homes and other providers are meeting basic quality and safety levels and whether to pursue any remedies. As a result of the pandemic, about a third of all nursing homes are overdue for an inspection at the start of this year. Many had last reported inspections prior to the pandemic. And now, under Republican budget proposal cuts, this backlog would be compounded, with CMS unable to complete 38% of required home and safety recertification surveys for nursing homes and home health agencies, leaving 1.4 million seniors at greater risk of dangerous and unsanitary conditions. Dr. Grabowski, what happens to federal oversight over nursing home operations and quality of care if funding is cut by 22%? Are we able to ensure that nursing home residents are adequately protected from threats to their health?
That would be an absolute disaster. I was part of, once again, a National Academies committee. We recommended increasing funding. This was at baseline, and now this is talking about going in the other direction. Once again, these are frail, older adults, many with Alzheimer's and dementia. They're not able, in many instances, to monitor their own care. There's a real role for survey and certification to come in and ensure that all care requirements are being met.
Absolutely. These vulnerable Americans need advocates. They need family members to be able to share their concerns, have their concerns addressed. You know, in addition to cutting funding for CMS, Republicans' Default on America Act would also impose a 22% cut on the Administration for Community Living's Long-Term Care Ombudsman program. The Long-Term Care Ombudsman's work is to identify, investigate, and resolve complaints made by or on behalf of nursing home residents. Dr. Grabowski, tragic things happen when people don't have an advocate. A way to raise concerns, to take actions. We've heard those heartbreaking stories right here in this room today. What will happen if we cut ombudsman funding, reducing the resources dedicated to investigating residents' concerns about their treatment and their safety? Will these horrific cuts, as proposed by House Republicans, doom us to repeat these fatal mistakes of the past?
When the ombudsman program is properly funded, it's incredibly successful. Once again, that National Academies committee that I served on, we recommended increasing funding and making sure that the ombudsman program was working well across the country. Once again, some areas it's working really well, other areas it needs further support. We don't want to make cuts. That's, once again, that's going in the wrong direction. Absolutely.
No cuts. Let's learn from the mistakes of the past. The reality is, again, when we were looking at the pandemic, American deaths, 1 in 10 of all COVID-19 deaths in America was linked to a nursing home. At the height of our pandemic, 1 in every 50 nursing home residents died of COVID-19. No more cuts. Stop these draconian threats on our people, and let's learn from those lessons past. Thank you, Dr. Grabowski. I yield back my time.
Thank you. I now recognize the ranking member for the purpose of a closing statement.